Welcome to the Whole Health Podcast,
where a functional nutritionist and a biological dentist investigate the interconnectedness of your health.
Let's get started.
All right, welcome back to another great episode of the Whole Health Podcast. Today, I am thrilled to be joined by Dr. Scott Schroeder of Wenatchee, Washington. I'm going to give a little bio here to kick it off, Megan.
Do it.
Dr. Schroeder is a foot and ankle surgeon with over 30 years of experience. And he's been involved in a decade-long study that has involved the removal of over 1,000 metal implants in over 400 patients. He's observed significant symptom improvements in patients following the implant removals, which is interesting because for years I was placing metal implants. This is going to be a good topic. In 2019, he presented to the FDA regarding the systemic effects of metal allergies and reactions in his patients. He has also lectured internationally on this topic, which is how we met. You've been involved in a study surrounding in vivo, meaning in real humans, galvanic reactions between orthopedic and dental metals. And he is removing from the foot and the ankle in the patient's dental metals. You were educated, got your bachelor's degree at Washington State University and your doctoral degree at California College of Podiatric Medicine, and did a surgical training in San Francisco. And you've also, I think this is awesome, you were awarded the Washington State podiatrist, I'm so used to saying pediatric for dentists, awarded the Washington State Podiatrist of the Year in 2005. Dr. Schroeder, thank you for being with us. I think this is going to be a topic so worthy of everybody's attention, talking about metals in the body. So as a starter, as a surgeon who was placing metals for years, maybe introduce us to what happened such that you became aware of, hey, there's something going on for some of our patients with these metals.
Yeah, that's what we had to use. Stainless steel, and then came in titanium, and that's I'm basically fusing joints, making cuts in bones, realigning, and we have to fixate that. So we have metal, and that's the way it is. We weren't really trained a whole lot on what can happen with these metals as time goes on and how it can affect human health. We think, okay, yeah, you can get a rash, and that's about all we really knew. And but as time went on, about 15 years into my practice, I started having these patients come in with these other symptoms. One of my patients, she had rheumatoid arthritis, but no real symptoms. She was diagnosed with it, but then she came in after I put stainless steel in her foot, and she could not open a door with one hand. She had to use two. And she couldn't button up her blouse. Wow. I ended up taking out her stainless steel screws. Next day, she could open up a door and button up her blouse. And I'm going, that is, weird. And I hadn't heard of that, And then another patient, a very, well-to-do and prominent a gal in our community, and I had placed titanium plates and screws in May, and then went ahead and we were planning on getting it out at the time. It was a little bit later on, and about 50% of the time I'd remove the hardware anyway, just because the foot and ankle things can rub and irritate, in shoes. So we were planning on getting it out because she liked to wear dressy shoes, So then I went into the pre-op, and the staff comes in and says she's not in a very good mood. And I walk in and I go, what's happening? Oh, man, ever since June, I just felt like I've had the flu. It's hard for me to get up from a sitting position. I can hardly move my neck. I've seen 3 different doctors here. They just don't know what's going on. They're going to send me to a specialist in Seattle. And I go, okay, that's pretty weird. And, next week we took the metal out. So, she had some symptoms in the foot. So I asked her, came in her post-op in 5 days. Okay, well, how you doing? Oh, great. Foot doesn't bother me at all. And no, how about everything else? She goes, oh, it's all gone. From June to, in the fall, she was every single day was a struggle, and then it's gone. And so then that was really the aha moment for me. And so then I really started paying attention, started asking a lot more questions of my patients, and finding all these things out that I had no idea. Chronic fatigue, fibromyalgia, migraines, neck pain, diarrhea, chronic from, within a week of me putting the medication in, all kinds of studies, endoscopic, colonoscopies, no help. I take the metal out a year later. Within a number of days, diarrhea is gone.
Whoa.
So, just these dramatic, and, other cases we will probably talk about, the paralysis patients and what have you. But, so that's kind of how I got into things. And, and ever since, and one thing is, metals, we need them. And just for helping people in society. So, everybody who puts them in, yes, but not everybody, can tolerate them because all of our bodies are different. In one of my studies, in these 400 patients that I removed implants from, after about 314, that's when I really started paying attention. So I actually did a study, observational study, where I looked, okay, how many had systemic symptoms or symptoms that were life-changing after I removed the metal. And it was 70 or 83 of those 314. So it's about 26+% that had life-changing symptoms after I removed the metal. And that's a quarter. That's significant. So then I started, and we don't know, a lot of the symptoms, as physicians, surgeons, we don't know the right questions to ask. But now there's been some other studies that have come out that, out of even the government, that, hey, they know these symptoms now, and we have to start paying attention. As physicians, surgeons, primary care providers, all that, when people come in with these symptoms, metal reactions or allergies have to be within the differential.
In functional medicine, we typically do a timeline, and we start at birth and we go, what's happened in 0 to 10, 11 to 20, and we kind of move along because we're looking for those moments. Like, when did things shift? Is there something that happened, right? But what I'm hearing you say, and I'm curious about this, people are responding to you, or they're noticing something when you take the metal out. Does that mean they're not always noticing, or they're not making a connection that the metal going in was there? Or maybe it's one metal and then they get another metal, or maybe it takes time for these things to develop. Kind of walk me through that if you're listening right now and you're thinking, like, I don't know if metal's a problem for me. What happens?
That's the problem.
Okay.
Because the timeline is the key. But the problem is the timeline is different from patient to patient.
Okay.
So sometimes you have a reaction where it starts right away, whether it's local or systemic. But if it's an allergy, it can be it's a type 4 delayed hypersensitivity reaction, which can take months to years later. I've seen them start 3 years later, or even longer. But why would somebody think that symptom was related to this surgery? What
would those symptoms be? Give us some examples of what that would look like.
So brain fog.
Okay.
Brain fog coming on, chronic fatigue, fibromyalgia.
Okay.
One of our patients that we've been discussing is a paralysis patient of mine. I did the surgery, put these 8 small stainless steel screws in his foot. He had neuropathy from his knee down. He was an engineer from an area, worked on the dams, and his toes were curling, and he was getting ulcers at the tips of his toes. So he came in for that, and then found out he also had prominent bones in the bottom. So we went ahead and we tried conservative things, didn't work. So I had to straighten the toes out, put stainless steel pins in the toes to keep them straight, both feet. And then I shortened the bones here, because he was like a diabetic, even though he wasn't diabetic, because he had this neuropathy. And so shortened the bones, stainless steel screws. Okay, they don't bother. Leave him in. This was back in the day. And so then he after 2.5 months, he was healed. Fine. See you later. And then ended up coming back 5 years or so later. And then he had another problem with a big toe that was curling down. But I saw all this swelling over each of these. I go, what's going on there? And, does it hurt? No. Now my neuropathy is over my entire body. And so I go, well, let's get those screws out, bones healed, maybe having a reaction, maybe a possible, allergy to nickel or something. So let's just get them out. So we did that at the time I did the big toe surgery. He came back a couple weeks later and said, hey, doc, I have to tell you. And I didn't know about the paralysis at that time. He goes, he said, I didn't put it all together. And this is a metal engineer. That's what he was doing. He's a metal engineer. But then he started putting things together. He actually had to go to Europe to really start, looking at this stuff. And he goes, it's about 3 months after your surgery, I started having episodes where my body would just seize up. He could breathe, but he couldn't talk and he could not move. First time was 45 minutes. And then it resolved, and then it progressed an hour a day, 2 hours a day, 10 hours a day. He was paralyzed. And so he went to UW for all kinds of genetic testing, went to Mayo Clinic. They did all kinds of testing. Said, sorry, you're just going to be in a wheelchair the rest of your life, and eventually your wife will have to put you in a convalescent center.
Terrifying.
Yeah. And, he's disabled, obviously, from work. And then he goes, then you remove these screws, these stainless steel screws from my feet. I went from being paralyzed 10 hours a day to 3 hours a day overnight. He goes, something's going on with my body. And that time I was already, lecturing. I was, I was around the world and what have you, and working with immunotoxicologist Dr. Vera Stetskal over in Europe. She's from Sweden, and she invented what's called the ELISA test, type of a lymphocyte transformation test that looks at the blood cells, the lymphocytes, the inflammatory cells, and then it challenges them with different metals and different concentrations of the metals. You get what's called the sensitivity index to see how allergic a patient is or not, or sensitive to these metals. Well, so we sent that off, and she was working with us at the time, and found out he was allergic to nickel, which is in the stainless steel. It's about 14 to 16%, stainless steel in his feet. And then he was also highly, highly allergic to palladium. And I didn't know where palladium was. Well, guess what? His white gold crowns had 26% palladium. What? And he had plus he had amalgam fillings. Plus he had a titanium screw in his knee from an ACL repair. So I already knew he had a plan. I go, what are you going to do? and he goes, well, I'm going to get this screw out of my knee, and then I'm going to work on getting the amalgams out, and then the gold crowns. The day he got the last gold crown out, he has not been paralyzed since. And I mean, this is a stiff person syndrome type diagnosis.
It's like goosebumps everywhere.
Yes. And
people do not know this.
No, they don't. And I've had actually 2 other patients. Same type of thing. And in the medical literature, at least so far that I've seen, there haven't been a dramatic improvement like this in stiff person syndrome. So it just makes me wonder how many people are really out there that may have something that they have no idea, and their docs and surgeons don't have any idea, because nobody really knows about it. People are starting to learn more and more, but we're not really there yet.
When we were off camera, our team here said, your podcast is a roller coaster. I hope you're all realizing right now that you are on the roller coaster, because that is astounding. And Kelly and I have talked about this in the past a little bit, but not to that level. And it's jaw-dropping, actually.
Yeah.
That severe of a reaction. And now I think we have to talk about the different metals. Okay, you go.
Well, there are 2 things here and we were talking about this last night at dinner, about there's sensitivity issues, but there's also, which I'm so excited for you to get into, energetics. Mm-hmm. I mean, I don't remember at what point in my high school education, maybe it was physics or chemistry or something, where you're putting dissimilar metals together and you're measuring current, and you're like, well, this is fascinating, and then I go to dental school and I put all sorts of metals in people's mouths in a bath of, salt solution called saliva. Mm-hmm. So let's dive into first. What do you want first? The energetics, Megan, or you want the sensitivities?
So much. I want the energetics first. Mm-hmm. And I'm going to ask you to dumb this down on like the dumbest down level ever, because Kelly said to me a lot, like a battery. And I'm like, okay, I kind of get it. I use batteries, so I sort of, but like, can you dumb this down to the level of like the basics of how these metals interact energetically in the body?
Yes.
Okay, thank you.
Yes. So we have each metal has its own charge. Okay. Positive charge, negative charge. And it's really not if one's positive or negative, it's one is more negative or more positive. Okay. So both could be positive, but then one is more positive or less. So then you get a potential reaction and you put it in an electrolyte. This is physics 101.
Yeah.
We did these studies in physics 101.
Yeah, high school.
High school, college, what have you. And but once we get to the body, it seems like all the rules are out.
Yeah.
Because we're putting dissimilar metals here, there, and everywhere. But actually what brought me to this was actually this case. Because I was going, okay, he wasn't paralyzed before I put the screws in his foot. But then we got him out, and he went from 10 hours to 3 hours. How come it's not completely gone? Mm-hmm. Mm-hmm. And so then we find out then this relationship, because of this ELISA testing, that we had this palladium that I had no idea where it existed, but found out it was the mouth. So, okay, we get this. He gets the last palladium filling out, completely paralysis free. So I go, there's got to be a relationship, and why was he continuing to have a problem? Well, I'm going, okay, gold is one of the most noble metals, so it's very positive, where stainless steel is definitely more negative. And so then I go, okay, I wonder if we're getting a battery reaction between the two, a charge going through, or at least a voltage potential between the two. So that's when I started I presented the FDA, and in there, in my office, or actually my kitchen, I laid out a Hot Wheels track. I mean, literally, I presented this to the FDA, and I took a stainless steel plate and a titanium plate, and I actually had worked with a neurologist in town that did diagnostic testing. I said, "Can I borrow some of your equipment to kind of test these?" I tell him I was up to. He goes, "Well, actually, what's best? Get a high quality voltmeter and an ultrasound gel." And that's actually going to work better than what I got. Okay, so that's what I did. And, they were an inch apart. And it was like 400 and something millivolt change. And I'm going, whoa, but I think I'm having a problem 6 foot away. So I ran the Hot Wheels track, right, 6 foot away, and I put the stainless steel and titanium. It was still like 118 millivolt change. I go, oh, I wonder. So then I presented that to the FDA, and apparently when I was doing that, the orthopedic surgeons and everything in the room just started looking up, because they hear about galvanic reactions, but don't,
Right.
Not really sure if this is real or not, because sometimes they use titanium plates and stainless steel screws, or they're getting away from that more and more, because the metal companies are saying, hey, you shouldn't be doing that. So that's good, and I think the companies are understanding, and we just really want to work with the companies to make the best. I mean, we're still going to need metal at this point in time until we develop and the companies develop, and really I think it's an opportunity for money for them to really start developing more, quote, biocompatible and devices, and it's said that titanium is biocompatible. No, well, it's not, totally compatible. Mm-hmm. But it's partially, and it is better than most everything else we have. But it's not non-reactive. It's not inert. So that's an issue. But so getting back to the charge then, when I was there, one of the docs said, "Well, boy, sure would be nice if we could test this in the body." So I go, I think I can do that. So I have my own surgery center. So I went back, and while I was removing metals from the foot, in our surgery center, then I'd test them to the metals in the mouth. And so actually I have samples if you want to see.
Yes, please.
Okay. So I don't know if it's good to, I'll just kind of show, but this is an amalgam filling that we have. Okay.
Okay. So we're looking at an amalgam filling in the
mouth.
tooth. Okay.
Yep. In the mouth.
And you've got a little pointer thing at it. So
that is a probe.
That's a probe.
Okay. To the voltmeter. Now this shows a little blood, so kind of warning as far as the next one, depending on who's looking at whatever.
Yep, you're talking to me right now.
And,
all right.
So I'll
the reason
show
I'm a
it.
nutritionist.
And,
holy cow.
So this is a titanium plate and screws I was removing from the foot, right? Okay. So the charge between the two was 154 millivolts. Okay.
Is that a lot?
Well, okay. Now to put this in context, right?
Okay.
So action potential of a nerve, the resting potential is minus 70 millivolts. It fires off at minus 55 millivolts. So that's only a 15 millivolt change between the resting potential and where a nerve fires off.
Wow.
Okay. So we have a minus 154 millivolts, right? And then I remove the plate and screws, test to the bone.
Yeah.
And then it is.
Now we're holding up just the bone. Here's the bone.
Yeah.
Okay.
And then it's 7.1 plus 7.1 millivolts. So we have 160, millivolt change before and after I remove it. And this was, significant. Well, and this was very consistent with all these ones that I did. And one of the most noble metals we talked about was gold.
Yeah.
And so here is that.
Gold.
There's gold. And then that was between that and a titanium screw that I was taking out of the foot. And what is it, 371?
371.2.
Right.
Nuts.
Yep. And then I took the screw out, tested the bone, it was 43. So still over a 300 millivolt change before and after removal.
Which is, I've got to say this, because Dr. Schroeder and I have talked about this previously, that oftentimes when we're talking to colleagues where they just haven't become aware of this yet, and they'll say things like, where's the science? And it's like, are you look at it.
It's measured.
You're literally measuring it.
Literally.
With, you could get this at Home Depot, the measurement device, or maybe an electrical store or something. But This isn't rocket science. This is just simple science. This is
Physics 101.
Simple physics 101. And I love what you started with, by the way, in our talk about like, hey, you came out of school and like we got medals. And in the 90s when I was in dental school, that's all we had was gold crowns, porcelain fused to metal crowns, metal bridges, metal partials. It's just metals. That's all we had. However, things have transitioned over the past 20 years. I'll be interested to hear your experience now with ceramics, like biocompatible glasses for the mouth, ceramic implants to replace teeth, and what you're seeing energetically with those. Are you convinced now that there's an energy issue to consider?
I get it. Now I get it. But now, before we go to sensitivity, because I need to finish my understanding of this, or at least get a little more understanding around how this interacts in the body. So if you have this voltage happening between your mouth, your knee, your mouth, your ankle, something like that, is it frying the nerves? Is it like hyperconducting the nerves? Like, what is actually happening in the tissue of the body when you have this charge?
I believe. Okay. I mean, this is definitely something we need to work with, and study. As a whole medical community, including all the the patients, but really it's up to the scientists, the professors and the doctors, universities to really look into this, right? And so I believe, it's my feeling because I think about this quite a bit, in the middle of the night.
I bet you do.
All that stuff.
Yep. And now I will
too. Yeah. So if we truly, are having a microcurrent going through here, right? And whether it's milliamps, whether it's picoamps, nanoamps, whatever. It is. We have the cell membranes, right?
Right.
And how do things cross the cell membranes?
Right.
It's charges,
yes.
right? And so it's a bioelectric, biochemical, electrical chemical type reaction. And if we have a constant, potential between the two,
right?
Is there a possibility of changing that?
So it's potentially changing the charge, affecting the cellular membrane and what can get in and out all the time.
Exactly. Yeah. So whether it's nerves, or what have you.
Yep.
Yeah. That's my concern, I guess. And
mind blowing. But also, then, does it affect the trace minerals of the body?
Well, now. Okay, so, and this is where I'm just starting to, I really want to know, and so I'm reaching out to detox specialists and docs and functional and integrative medicine and all this stuff around the world, really. And one of the things that I present in my talk is metabolic changes associated with this, because it can, then things can, the metals, whether it's again from the metal itself and corrosion, and then the metal ion going out and then binding to a certain site and blocking, another site of an essential metal that's needed or essential mineral, that's needed. And that is what can happen, is what I'm told. And so it's just putting the whole consortium of everybody together and really talking about it. Okay, this is what I find. What do you see? This is, and that's what I just talked to one of the docs in London about. And she's just, going, this is what happens, and when, especially with the metals, she sees these metal problems all the time. She works very closely with them. And so it's just, Dr. Poirier is her name, Shide. And so she is very, impressive, and she understands a lot of this. And it can affect, all of that.
It's mind-blowing, and I'm thinking about all these conditions I see in my patients that this is why we can't sleep, because we have to think these things through. But you think about all the things that are neuromuscular that we're seeing now. And there's a lot of focus on microbial factors, for sure, infections, et cetera. And even I'm thinking about my screening, I talk about metals in the mouth all the time. I ask what's going on in their mouth. This is big, but I don't say and by the way, do you have a screw in your toe?
Mm-hmm. Yeah,
it just never comes. It's not even
part of the.
We might catch it when we do our timeline, but we might not because it's so normalized.
Yeah. Mm-hmm. And that's what I was talking to Kelly about too. Yeah, is that we have to have the timeline, but we have to include all the surgeries. And then surgeries, belly surgeries, cholecystectomies, endoscopic, using metal clips.
I was just saying to your lovely wife that I have a patient who did not realize they were going to put metal in when she had her gallbladder out.
Yep.
so sensitive to metal, and it obliterated her health for 2 years. And they just kept telling her she was nuts, and they never told her there was metal. She asked, and they had put in some sort of a netting that was made of metal, and then
metal?
staples. Yeah.
Yeah. So I say that I work with those people
Wild.
a lot because they get a hold of me because
Of course.
they hear about me, and
Right.
then people connect them to me, and then one case in point, she was a psychologist from Boston, and she had her gallbladder clips out, and she was good for 6 to 8 weeks, but then took a crash. She crashed again. So heard about me, contacted me. So I started asking them my questions. And my questions are, okay, what other surgeries have? Well, I had a belly surgery. Well, check to make sure you didn't have clips. Nope, she didn't. Oh, I had a thyroid surgery. Thyroid surgery. Oh, did they tell you they used clips? No. And well, get an x-ray. I think she had like 24 clips. Very small clips.
Wow.
Titanium clips. She luckily found a surgeon in her area to remove them. She wasn't able to remove all of them. There was one that was really close to recurrent laryngeal nerve. She felt if she damaged that nerve because of scar tissue, then she wouldn't talk again, right? Or had problems talking. So, but they got 23 out of 24 out. Wow. She was on the couch. She couldn't be off the couch for more than 5 minutes at a time. And she was actually looking at going to Europe for doctor-assisted suicide because her life wasn't worth it.
Oh, my goodness.
Yeah.
Wow.
Well, yeah. I see, suicidal ideation all the time with these patients, just, because they're crazy, right? At least they're told they are.
Right.
And
Right.
so anyway, she gets clips out. Within 2 weeks, she was walking over a mile with her friends. I mean, she was back to, just, and so, yeah. I mean, that's what I deal with all the time. That's what I see. And,
So let's talk about Melissa.
Okay.
Let's talk about metal sensitivity.
Okay.
Because you brought up something specific there relating to palladium, which what person walking down the street, first of all, knows what palladium is and why it would be in a dental crown? Physicians wouldn't know that. It's like, nobody's checking the crown when it comes into your office to say, hey, what's the percentage of the metals in this thing? So in a simplified way, can you describe a type 4 hypersensitivity reaction? And what are the more common metallic elements that you're seeing that more often, well, at least for some percentage of the population, are triggering?
Mm-hmm. Yeah. So as far as a hypersensitivity reaction, were we born with metal in our body? No. So then it goes into your body. What's your natural immune system going to do? It's going to check it out and say, hey, I don't like it. Or it's fine with it. All of us are different, right? All of us. And that's why a lot of patients, at least so far in my study, 75% were fine. I mean, they didn't, and I wasn't asking everybody all the questions, but still, so many of us do just fine with what, our total knees or hips or whatever, I'm not anti-metal as far as that goes. Mm-hmm. It's just that we have to pay attention as physicians, surgeons and physicians. So in this case then, it can come right away as far as the reaction, where you start developing something, and it's different in everybody. It could be a rash, it could be a rash. It could be pain in the area, swelling. That's very common, in the area, but then it gets better. You expect that, though, after surgery, right?
Right.
Yeah. So then it should get better. If it doesn't get better, or then you start looking at other, systemic symptoms going on. And like you say, it's delayed. So it may be days to weeks to months to years. And that's the problem in diagnosing things. But you have to ask the questions. And then many times I can go back to when you got that in. Oh, it's 3 months after, or it's 6 months or a year with that. And so then some of the metals, then, nickel is the most common allergen as far as metals go, by far. And but unfortunately, nickel is in everything. Or almost everything, not ceramics as much. Ceramics are a different animal altogether there, in a good way, as far as that goes. But like titanium, the surgeons believe that titanium's nickel-free. And so far, there's what's called the Holub study, and not the Holub, sorry. It's a Harloff study, and it looks at all the different metals, even pure titanium, commercial grade titanium it's called. It still has 0.013% nickel. And if you're allergic to something, then like let's say a child's allergic to peanut butter. Right. Is it okay to feed them just a little bit of peanut butter? Mm-hmm. Yeah, not so much, so same type of thing. And not everybody, but there are certain people that are very sensitive. And so that's where some of this testing comes in, where it's the ELISA test. There's orthopedic analysis out of Chicago, which is a lymphocyte transformation test also. Not quite as refined, but still, I've used it a lot just because it's hard to get my blood over to Germany, in a timely manner so the lymphocytes don't die. But so then that nickel is 14 to 18% plus, depending on in the human population, depending on what study you look at, and then you look at so that's probably one of the most common. The aluminum is another one.
Yeah.
Aluminum, so we have to look at that. Some of the titaniums are much more difficult to evaluate. Like Mayo Clinic did a study for 10 years where they're doing patch testing and didn't have one positive patch test for titanium. It's a larger molecule, so harder to get into the skin to cause an inflammatory reaction, is my understanding. But even during that time, they had titanium implants of total knees, hips, whatever that they had to have removed, and they got much better.
Right.
So is titanium more quote biocompatible or better than some of the stainless steel, especially in a nickel sensitive patient? Absolutely. So and that's where they'll go to that. But unfortunately, you don't know until it's in the patient sometimes.
Okay, so sometimes people might know that metal is being implanted into their body for one reason or another. Your doctor says we're going to put the screws in or the plate in or whatever it may be. There's some other situations where maybe you have your gallbladder out and you don't realize they're going to use metal staples or something. So you need to be asking these questions. Do you use metal, blah, blah, blah. And that makes sense to me. But are there other materials that we're using in these surgeries or in the world of dental that you wouldn't think are metal, but they actually have metal in them? Like, are there composites or other materials?
Good question. I mean, when we were talking about this last night, that, we've kind of leaned into the biocomp company to help appreciate which products, whether you're talking about a dental ceramic, whether you're talking about dental composites, of which there are hundreds of brands. So, like, most of the people who are coming to see me are making a very significant and intentional choice to move their health forward, remove things that have energetic potentials and replace them with products that do not. But from an immunological standpoint, the question then is, how do we ensure that these products are most compatible for you? So like we've been using Biocomp to help appreciate that. Because most people are going to have some composites that do well. Same thing with ceramic crowns. Like these ceramics do well with you and these do not.
So we're pre-testing to see what materials we're most compatible with, whether it's metal or whatever. Maybe not metal, but metal, we're worried more about that.
And I think dentistry right now is in a fortunate place where we do have, for instance, like ceramic implants.
Right.
Which, golly, in reality, they've been around for 25 years, but they haven't been common, but for maybe the last 10.
And I am very jealous of the
because podiatry.
I don't have those options.
What do you have?
I don't. I have
stainless
steel, metal, and all this, And so this, in case in point, as far as the energetics, here's a stainless steel plate to a titanium dental implant, 111 milliliters.
I like this. So you have a stainless steel plate
that I took out of a patient
that's then connected to ultrasound gel, and on the other end of the ultrasound gel is a titanium dental implant.
Right, and two positive and negative probe from the voltmeter.
Reading 112 millivolts.
Yes, essentially. Now, this is same stainless steel plate to zirconia ceramic. What does that read?
Oh, wow. Negative 0.1.
Right.
Basically
so
nothing.
Negligent, yeah.
Wow.
Yeah. So that's what we're talking about, quote, energetics.
Yeah.
Right.
Between the two and the potentials, the voltage potentials between the two. And this is very consistent with a lot of the dental, ceramics and choices these days, as far as that's what I saw. And, again, we're just getting back to physics.
Yeah.
Right.
Okay, so you're a patient / listener right now, and you're thinking, well, crap. That's what I'd be thinking.
Yeah, I already had my ACL.
Crap. I've got a metal in my knee. I've got a couple of fillings. And I also happen to have fill in the blank diagnosis.
Yes, exactly.
Hashimoto's, ALS, I don't know, whatever, name it, right? What do you do?
Okay, so this is the way I approach these, because these are the questions I get all the time.
Yeah,
right?
sure.
Number one, you have to look at the different diagnoses that go on, and that's why one thing, there's two studies that they'll put up but one is this is actually a paper from the FDA.
Okay.
And it's called Biologic Responses to Metal Implants, September 2019, and they have tables in there of all these diagnoses listed. Okay, they know.
They know. Okay.
They know.
They know, which
all
means
these,
we
yes.
can know.
Yes,
Okay.
exactly.
And that's accessible to anybody online, correct?
Biological
FDA,
responses to metal implants, September 2019. Okay.
So
Okay.
You can get the PDF.
So
You can
yes.
get it.
Now this paper is the paper that every single physician, I believe, and surgeon, dentist, whatever, need to have. Okay. It's called a comprehensive summary of disease variants implicated in metal allergy. Well, I think also in reactions. Metal allergy and reactions. I would add that in.
Yeah.
So it's out of the Allergy and Clinical Immunology branch of the National Institute of Occupational Safety and Health. Okay. So this is a big wig thing, right?
Yeah.
This is Roach et al., R-O-A-C-H, and it's in the Journal of Toxicology and Environmental Health. All
From
right?
what year?
This is 2022,
Okay.
December.
Okay.
So it just came out
Just
not long
came
ago.
out.
So this is one of the tables. There's multiple tables that describe all kinds of oral eye, all kinds of things. This is one of the tables on inflammatory conditions and rosacea, psoriasis, celiac disease, irritable bowel syndrome, ulcerative colitis, lupus, rheumatoid arthritis, chronic fatigue syndrome, Sjogren's syndrome, fibromyalgia. Have you ever seen any of those in your practice?
Yeah. One time.
I know. Well, that's what I'm talking about. So this has to be within the differential diagnosis of any provider out there for healthcare.
Absolutely.
I mean, it just has to be. And so then you have to I love what you do with their timeline. That's what you have to do. Okay, so then you figure that out. Okay, now you have all these different things, okay, in the body. Okay, which one's causing the problem? Well, number one, some of the testing that you're doing, the biocomp, the lymphocyte transformation, ELISA type test, and then you can find out, they're allergic to, titanium. Okay, well, they have this titanium plate and screw in their wrist or their ankle.
Right.
Okay, well, is the bone healed? Yeah. Do you need it anymore? No, it's just sitting there. So, okay, get it out.
Yeah.
And vast majority, and some surgeons don't want to,
Right.
just because, but hey, they have to discuss the risks and complications with the patient, and the patient has to be their own best advocate.
Yeah.
They've had to fight all the time. And we've done actually their studies. Dr. Jifa Dorduna up in Canada, Victoria, study, it took her, these patients 5 to 6 years to, number one, they went through multiple doctors to find somebody that would actually help them and get the metal out. And it took, that long. But in that time, many times, like the symptoms that you see, they're not contributing to society either. It's very costly for the healthcare system. Plus all the medications they put them on to treat their, quote, fibromyalgia and all this stuff. And then I have had these patients, I get the metal out and they go away. It goes away. We're done with the medications. And so then you get the simplest metal out. Okay, is it amalgam filling?
Yeah.
Okay. Easy,
Easy access.
relatively easy. You have to be safe about it, right?
For some.
Yeah,
for
yeah,
some.
right.
Yeah, I know. Yeah. So, and that's not my problem. That's his. Yeah.
Right, exactly.
So I'm good.
You're welcome.
Punt that to the
I
dentist.
know, exactly. And exactly. That's why we have to all work together.
Yeah,
That's why I'm reaching out
collaboration.
to Dr. Blodgett and all the the dentists, and here's a foot and ankle surgeon going to the International Academy of Oral Medicine and Toxicology conferences.
Yeah.
They're kind of like, what are you doing?
Why are you here?
Yeah.
Yeah.
And then I start, meeting them, and now I'm going to be presenting for them. Well, I presented for them down in Istanbul in May, and then again we're going to do it in San Antonio in March. And because we're related. Even though they may not have known it, I'm going to show it to them, and we all have to work together. So yes, you get and then you get to the difficult problems, the total knees and total hips.
Right.
And I work with those people too, just on a metal allergy side, just to guide them. I'm not their physician or anything like that.
Right.
They have to talk to their own doctor.
You're advocating for them.
Yeah, I'm an
though.
advocate. Yeah.
Yeah.
But I walk them through how to do that.
Okay.
And but a lot of it, what the surgeons really need is an allergy test, really. Even though there may be electrical, that's a whole different ballpark.
Right.
But then it's the allergy testing. That's when they'll buy in and believe because they can see something.
Right.
And so that's where they really will believe. And we need to get that total knee out and then replace it with something that you're more compatible with your body. But then there's the other things, like you say, that they never even knew they had. And that's why a lot of people that have cholecystectomies, thyroids, other conditions where they have metal clips placed and they never knew it, because that's standard of care right now. I mean, the surgeons don't tell the patients that, they just use it. It's, we used to use, they used to use sutures all the time. I assisted in open cholecystectomies. We tied everything off. I was holding the clamp, everything for the surgeon as he was, the general surgeon, as he was tying things off with suture. No metal. We never didn't use metal.
Right.
And so, but now it's easy. It's fast and easy. It's faster. It's more time efficient. Costs less.
I like a staple gun. I mean, I'm just going to say it.
Right.
It makes my life easier.
Exactly. But does it make it easier for the patient?
Right.
Yeah.
And there's probably many that are just fine, but others aren't, and that's where you have to ask the questions.
Mine is blown.
All right. Well, as we get to the end of this, I would love to know, actually, we would love to know, because we like to ask our guests, what does whole health mean to you, and what would you like to impart to our listeners?
Whoa.
You didn't see that one coming, huh?
No, that's, whole, you have to look at everything. And really, in my world, this is missed so often, and it's so important. And unfortunately, things like one of my patients that I presented to the FDA, she was, I had took stainless steel out of her, put titanium in, thought it was okay, and she did fine. And then she comes back 2 years later. These are bothering me. Can we get them out? Sure. And so we find out, actually more than that, but find out that she had a bar, placed because she had braces. Yes. Well, all of her symptoms started within a month of getting her braces on. Okay, chronic fatigue, fibromyalgia. She was on 18 different medications for fibromyalgia at the time and her headaches. And so after I removed that, she got her bar out. She went down to one medication. So you're talking whole health, right? She had no clue. Of course, her orthodontist had no clue. I had no clue because I didn't know about it. And at the time, until we got things out, and boom. And I had tested her. She was, sent her blood off, and she was allergic to nickel and to titanium, vanadium. And
Get your periodic table out for this.
Yeah, right. So multiple metals. So anyway, the whole health to me means, okay, you know what you are, but you don't just always throw drugs at it. You have to get to the root cause, basically, of what is causing these problems, and that has to be within the differential. So whole health means evaluating, in my mind, especially when we're dealing with metals, what has gone into the body, what are the potential complications, side effects of that, and then that's the basis, in my mind, of where you start with a lot of this, and then you get into everything else that you've been working with in functional medicine and all this, and some of the ones some of the functional medicine docs I'm talking to that say, okay, we got to get rid of these molds first, and then we go on to this, and sometimes metal getting after the metal's out of the body. Then you have to detox it, right?
Right.
And so sometimes it's more difficult to get some of the metals out than it is to get some of it. And then these open the pathways to get the metals out easier.
Right, right. Well, I love your curiosity. Thanks for doing this work. This is just so imperative. I'm so excited to go tell everybody at my clinic about this, and then bring every patient back in and ask them if they've ever had a knee surgery or an ankle surgery or anything else, because, man, we might have missed it.
Yeah, and I look back at all my patients, just like every surgeon. I really would like to have a study. I ended up retiring, but go back and just ask every single. Would you have any of these symptoms? Boom, 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 boom. And when did it come on? Oh, it's after the surgery I did. I don't know.
Yeah.
But again, that was standard of care, and we all did it. But now we know different, so we have to start being a little more diligent, I think, as a medical community.
Do better. Yep.
It's so great. I'm so grateful for both of you as we sit here, that we all have our own unique lens, and when we're in connection with one another, we're so able to help people in more impactful and meaningful ways.
Absolutely.
Well, thank you, Dr. Schroeder. Yes. This has been awesome.
Thank you.
I look forward to seeing you again. I'm sure we'll be crossing paths soon.
Yeah.
And yes, thank you so much for your time and coming down to be with us.
Yep, you are welcome.
Really appreciate it.
You're welcome. You bet.
Thanks so much for tuning in to the Whole Health Podcast.
If you enjoyed what you heard today, please follow us on social media and wherever you listen to podcasts.
You can find out more about us at thewholehealthpodcast.com.
You can find me on my website, blodgettdentalcare.com.
And you can find me at bioloungepdx.com or learn more about my organic soluble fiber supplement, Fluorosophy, at thinkfluorosophy.com.
We look forward to seeing you next time.